Hi, everyone. My name is Valerie Hanks. I'm an occupational therapist. I have been an occupational therapist for about 22 years ish. I've been working at Vanderbilt Medical Center for the last 15 years in an outpatient setting working with neurological patients. That's how I got connected with CMTA, and I have been associated with them for many, many years, and I'm really excited to present today. I'm going to start sharing my screen. Okay. So, for those of you who might not be familiar with what OT is, we address self care impairment, so being able to care for yourself throughout the day. We also develop strengthening and stretching programs for your arms and your hands. And we aid in resolving any home management difficulty. So if you're having trouble, excuse me, cooking, cleaning, doing laundry, things like that, we also work on modifications related to working, going to school, and driving. So I have 5 points today that I'm going to talk about. The first one is daily stretching. The next one is using adaptive equipment. Then we're going to talk about night splints and a couple of day splints potentially, gloves that can help with pain, and then we're going to talk about exercise. So there's a difference between stretching and exercise, and we'll talk a little bit more about that as we go through the presentation. So the first one is daily stretching. Typically, we prescribe patients to do their stretching 15 to 20 repetitions once a day. You can certainly stretch more often than that, but we certainly suggest that you do it at least once a day. We suggest that the stretches are not painful. You might feel a bit of discomfort as you stretch your muscles and your tendons, but it shouldn't feel painful. And then we want you to focus on the areas that feel tight. So if you feel like you have a certain joint or a certain area of your body that feels tight, that's where we would like you to focus your stretching. So now I just have some examples of what these some stretches we might prescribe for your hands might look like. The first one is for your thumb. As everyone is aware, your thumb function is really important. So it's important to keep that web space open. So that L shape in your hand, we want to keep that as open as possible. So this is a stretch that you can do to help maintain that. The middle stretch is really a wrist and finger stretch, and you can start at the top, like the person the picture on your left, and then you just pull down as much as you can, but only into a comfortable space. If it becomes uncomfortable or you feel any numbness or discomfort, you should stop. And then the last picture I have there is just a whole hand stretch that will allow you to start with a completely open hand, move down into bent fingers, then straightening your fingers, but bending the first joint in your hand, and then making a complete fist. So those are just some simple examples of some stretches that you could do. Now I have put on this presentation some arm stretches because arm stretches are just as important as your hand stretches. Your shoulder is kind of um, the link to your upper body to keep your hand going. So we won't go through all of these, but these are just some examples of some arm stretches that you could do. And again, you'd want to do these every day if you're feeling tightness in your shoulder. Now we're going to talk about some adaptive equipment. You all have an excellent resource available to you. I looked through the gadget guide and it's just great. So please, for sure, use that. There's a lot of good information in that document. And the other points I wanted to make are that your adaptive equipment, you can use it all the time or just when you're having a weak day. So, you all know that your symptoms can vary. And if you're having a good day, you might not need the adaptive equipment, but having it available is not a bad thing. And then almost everything we suggest to our patients, you can find on Amazon. And now I'll just show you some examples of some common adaptive equipment. In my experience with CMT patients, in relation to their hand function, oftentimes they have difficulty just with hand strength and being able to open containers, um, manipulate small objects. So the top left picture, that's a key turner. So if you have trouble with your tiny keys, you can purchase a key turner and you then will be able to use your entire hand and forearm to turn locks and things like that and not have to use just your fingers. Then the bottom left picture, that's just one example of a tool to open pill bottles. They make lots and lots and lots of different things to help you open things. So just as simple as a piece of non-skid Dyson to automated or battery powered jar openers. And then on the bottom right, that is a button hook. If you have trouble with buttons, a button hook can be a great tool to help assist with that. And then the top above that, that is just an example of a walker basket. So if you have to ambulate with a walker, you want to be safe, and that requires both hands being on the walker. So putting something on the front of your walker to carry your items is always a great idea. And now we'll talk about night splints and gloves. So typically, we prescribe splints that are needed for stretching. In other words, if your hands tend to close at night, excuse me, then we'd have you sleep in the splints only at night. You wouldn't need them during the day. And then the one of the options that you might use during the day is a thumb support. If you have weakness in your thumb or pain in your thumb, a thumb support splint can be a great thing to help your hands. And then arthritis gloves are great for pain management. So if you have achy joints or your hands are hurting you, these gloves have been really effective in my experience to aid with that. So that first picture there, that's what I'm speaking about when I talk about the arthritis gloves. They provide a little bit of heat and compression, and you would sleep in those, and hopefully it would work for you if you were having that kind of discomfort. The second splint, that is an oval 8 splint, and those provide support to various joints in your fingers if you're having some hyperextension or your fingers are bending and you can't keep them open. Those type of splints can be very helpful. The third splint, that's just an example of the thumb support brace I was speaking of earlier. This is a custom molded one, so a therapist would have fabricated this in the clinic. You can purchase them over the counter, and the over the counter ones work just as well, usually. If you're having trouble deciding what you need, I would recommend seeing a therapist and they can help you determine what would work best for you. The last splint there, that is a resting hand splint, and that is the type that you would sleep in at night if you were having curling of your fingers or the inability to keep your hand open. We might have you sleep in that to help keep your fingers stretched out. And we won't, the purpose of that is that you don't lose range of motion and you can keep those structures nice and loose. So we're going to go through some general exercise guidelines. So as I spoke of earlier, stretching and exercise are two different things. When you're stretching, you're really just moving your body. When you're exercising, you're doing some sort of resistance or more aggressive movements. So, the guidelines that I've picked out are that you can complete them daily if you're doing your exercise without resistance. If you're using resistance, you should complete them every other day or 3 days a week. We want you to avoid pain, and it's important to engage your core when you're completing any type of arm exercise. So, some examples of what we might give patients with hand weakness. We might give you Theraputty. We might give you rubber bands. But the Theraputty is a really common tool that we give to patients. And I just showed some pictures of some examples that we might prescribe as exercise. And then the picture on the left, that is a finger extension within a resistive band. Again, I would encourage you to see a therapist if you're interested in some sort of exercise program, but you can certainly order yourself some Theraputty on Amazon and just give it a go on your own. That's perfectly acceptable. Just be mindful that there's different resistances of Theraputty, and typically the lighter the color, the less resistance there is. So yellow would be like tan or yellow would be really light resistance, and it goes all the way up to blue and black, which would be pretty heavy resistance. And then these are just some examples of arm exercises. And I just wanted to talk about being able to determine how much resistance to use, meaning how much weight do you use. You should be able to do 20 repetitions with good form. If you start to lose your form or overly fatigue, then you have likely given yourself too much resistance. And the same goes for the Theraputty. If you are working with your Theraputty and you can't do 20 repetitions, then you're probably using putty that is too much resistance and you need to get a lighter resistance. Now, as I spoke of earlier, maintaining your core strength is also really important to hand function because your core and your shoulder directly relate or directly correlate to your hand function. So these are just some really gentle core strengthening exercises that you can do. And in the picture, the person or the drawing, the person is just holding a really light weight. So you can certainly use a can of beans or a bottle of water or nothing. Just engaging your core will help you maintain your strength. And I want to point out that you can do all of these exercises in sitting. Some of the drawings are in standing, but you can replicate all of these and complete them in sitting. Okay, so I just want to review. These are our take home points. So we'll go through these one by one, reminding you that it's important to stretch every day, whether you do it in the morning or in the evening before bed or both. It's important that you do it every day. And then use of adaptive tools or adaptive equipment can help decrease the stress on your hands and increase your independence. So don't be afraid to use the tools that are available to you because it really will help preserve your hands. And then wearing splints and gloves can improve your range of motion, provide support, and decrease pain. So having to use a splint is not necessarily a bad thing. I would encourage you to recognize that it can actually really help maintain your hand function. And then resistive exercises should not be done every day, remembering that if you're using any type of resistance, you need to give your you need to give your body, your muscles, 24 hours to recover before you do any more resistive exercise. My prescription for resistive exercise is typically 3 times a week. And then the last thing is don't forget your core. We want you to always remember to engage your core and think about the importance of core stability when you're just doing simple arm exercises. Okay, so that is the end of my presentation, short and sweet, and now I will take questions. I see one question that's here. Um, Besides stretching, does using a hot tub help the muscles in the hand? I would say that use of a hot tub is great. Heat is one of the best things you can use for loosening your muscles, and your body will respond better to the stretches and the exercise if you are warm. So sure, if the hot tub helps you feel better, that's great. Can you over exercise? Absolutely. That is an excellent question. You can definitely over exercise. If you go through your exercise routine and then you can't do anything else the rest of the day, you have over exercised. So being mindful of your body is key to knowing what's enough. So finding just the right challenge to be able to go through your exercise routine and then carry on throughout your day. That's what we really want people to do. Should you push, manipulate your hand? Oh, I didn't get that whole question read. Can somebody pop it back up there? Should you push, manipulate your hand using your other hand? Sure. You can use one hand to stretch the other. That's great. If you are able to keep your pain in line, you can certainly use one hand to stretch the other. I think that's a great idea. Yes. Can you please expand on why core strength impacts hand function? I've never heard that before. Well, because your core stability is one of the things that we teach our neurological patients from the very beginning. If you have core stability, you're going to have better hand function. So, meaning everything comes from your core. So, movement, strength, coordination. If you don't have good core strength, good core stability, it will impact everything coming from your core. So it can impact your gait or your walking. It can impact the movement of your feet. It can also change the how your hands work and how your shoulders move. The, so yes, I definitely think that it's a very well researched and there's a lot of publications on the importance of core stability. Great question. Thank you. My teen wants to stay on the computer all day. Is this bad for him? Will it accelerate his condition? Wow. That's a loaded question, right? I think that as it relates to your hands, and that's what this presentation is really about, um, being on the computer and using your hands all the time can be very fatiguing. So that's really, I think the only thing I would be worried about is overuse and you getting your hands to a point of over fatigue. So, as a parent, sure, I understand your concern about being on the computer all day, but as it relates to CMT and hand function, I think the biggest concern would be fatigue. Let's see. HNPP and chronic carpal tunnel equals major neuropathic pain when exercising. Adapting strength is not easy. Any advice for very soft exercise with carpal tunnel? Oh boy. So yeah, that's tough. Carpal tunnel is difficult. I've had surgery on both of my hands for carpal tunnel, so I understand the pain that comes with that. I would suggest trying night splints to decrease the stress on your carpal tunnel. One of the stretches that I showed in my presentation, the prayer stretch, where you put your hands together and you just pull them down as as much as is comfortable. I would try that one. The other thing that you can do is get online and look up median nerve glides and try to do just nerve glides and don't try to do a whole lot of resistive exercise. That's what I would suggest for carpal tunnel. Oh, if I'm losing my balance while sitting, is that due to core weakness? It certainly could be. There's a lot of reasons that you lose your balance, and um, part of it, there's so many different factors involved with balance, but it could be your core strength. It also could be a coordination issue. It could be related to your vestibular system. There's so many things involved with keeping your balance, but I would suggest trying to do a little bit of core strengthening and see if that doesn't help. I would also suggest that you maybe reach out to your doctor and ask to see a therapist. If you're losing your balance and sitting, there's some interventions that can probably really help you. Are there specific activities CMT patients should avoid? Are weak wrists typically associated with CMT? Any splinting at night for that? I think yes, you can get weak wrist with CMT. Um, if you're having difficulty with your wrist, a resting hand splint at night could help. And exercises to avoid, I just want to go back to that point of just the right challenge. If you are overly exerting yourself, you're putting too much strain on your joints, which is going to impact the soft tissue or your tendons and your muscles. So, being able to be mindful of when you've overly exerted yourself. That we never ever want to overly over exercise. But as far as specific exercises you should avoid, I don't know that there's anything you should completely avoid, but being sure that you are not overly exerting yourself. For my kid playing video games and using the mouse all day, is there anything I can do to improve his wrist pain without forcing him off the computer? Is this causing long-term damage? I can't speak to whether it's causing long-term damage, but yes, you can. They make day splints for wrist support. If you go on Amazon or just Google, it's called a wrist cock-up splint, and it basically just supports your wrist. It keeps your wrist in a nice neutral position so that you're not doing any damage to the structures in your wrist. You can wear that all day while you're doing activities. I often get cramps when stretching, particular with certain stretches. Is cramping typical with CMT? By the way, I do regularly exercise, swim, walk, weights, etc. Um, you know, I think I think CMT patients are so unique and everyone has, in my experience, the patients that I've treated, they all have different presentations. So I would say that cramping could be typical. I have had lots of patients tell me that they cramp. Part of the reason that we want you to stretch is to help reduce that cramping. If there's a position that you get in that causes a cramp, I would suggest trying a different position. And I saw that you wrote that you swim. Stretching in the pool is a really great thing to try, especially if you're in an indoor warm pool. that's a great place to maybe try the stretches that are causing you to cramp. You might be more successful in the water. It's just an idea. Can stretching for hands be preventative? By this, I mean, can it delay the onset of muscle atrophy? Unfortunately, I don't think that stretching your hands is going to change your disease course. The reason that we encourage stretching is to maintain range of motion and to keep as much function as possible. The stretching is more maintenance. It's not preventative. Does exercise stop fingers from contracting over time? No, exercise won't stop the contraction. The splints are what's gonna stop the contraction. So if you are getting contracted, you need night splints and you need to sleep in them. So if both hands are affected, then you sleep in your right splint one night and then you sleep in your left splint the next night. But the hand splints are what is gonna keep you from getting contracted. And if you're already contracted, it can help um, it can help get your finger stretched back out. Would it be helpful to wear wrist or ankle weights to build strength? For push ups, if wrists seem to be hurting, do you recommend doing push ups in a different way? I would not recommend wearing wrist or ankle weights to build strength. I think if you feel like you're weak, then doing regular exercise 3 days a week is sufficient. Wearing weights all day is gonna just that's overkill. It's gonna just overly fatigue your muscles. And then as far as push-ups are concerned, you can do push-ups on your fists. You can also do forearm push-ups. So the other alternative to doing push-ups, if you're having pain in your wrist, is doing like forearm plank, where you're just putting yourself in a planked position on your forearms and you hold it for 30 seconds. You're going to get good chest and core workout with a plank without the pain to your wrists. My mom is deaf and uses sign language, but also reads lips. I've never had good coordination with my signing. Is there any connection between CMT and difficulty signing? And what can I do to help this? I think that CMT can affect your coordination. So there are some like repetitive coordination practice things that we give patients. One is that just like this kind of coordination where you're touching your fingertips repetitively and you're doing that in a coordinated fashion. Um, that's just one thing I can think of off the top of my head that you can do to work on your coordination. Oh, I didn't see that one. I'm sorry. Can you pop it back up? What do you think is the most important thing or two for us to take away from this? Best thing to remember daily. Oh, yeah. Okay. So the two most important things are that I would say I want you to take home from this as using splints and support systems for your hands is a good thing. It can help preserve your joints. It can preserve your soft tissue. Those are the things that are the purpose of the splints. The other thing would be stretching daily is really, really, really important, and being mindful of your body and not stretching to a point of discomfort or pain. Do you recommend surgery consults for weakness where you can't hold something like a glass or a spoon without dropping it? No. Surgery's not going to help. That's where I would start recommending adaptive equipment. They make so many things that help with your grasp and help carrying things and keeping things in your hands. I would go see a therapist and let them help you figure out what kind of equipment could help you. I recently starting having a lot of pain in my thumbs, the joints in my thumbs. My x-rays show arthritis and I have follow-up soon. Are there specific things I should ask the doctor on the follow-up? Thumb weakness and pain is very common with arthritis. It also happens to be something that happens when you have CMT. I would just talk to the doctor about the severity of the arthritis. But my biggest suggestion would be to get online and purchase a thumb support brace and start wearing that. It can really help. Can you provide any insight for helping little kids of CMT patients where the kids have not been diagnosed, tested, toddlers, to work on or be conscious about littles that are growing up to make them strong as possible? I'm so sorry. I don't treat children. I feel like I would be overstepping the realm of my knowledge to give you any insight into kids. I don't treat children. I'm sorry. Have you heard of collagen or Botox treatments for hands? Sure. We suggest Botox to our patients with who've had strokes and spinal cord injuries, but I would not get Botox in your hands if you have CMT. That's Botox weakens your muscles, and your muscles are already weak. You don't want to make them weaker. And I can't really speak on collagen because I don't really know. My hands have started to curve. I wear night braces, but have trouble straightening my fingers. Are there gloves or anything to help with this? They're not really gloves that can help with straightening, but they make those finger splints that will help keep your fingers open during the day. Again, I would probably reach out and try to see a therapist to help you figure out which kind is going to work best for you. But you would most likely benefit from finger splints. I have 1 minute. Thank you all so much. I've appreciated this talk, and I really, I mean, I've appreciated all the questions. I think it's great for everyone to ask questions. Thank you so much.